As you may be aware, climate change, urbanisation, globalisation, digitisation have all been thought to affect the health of our young children, but we have little evidence to be able to support those hypotheses. We know that these behaviours are very important for children's health. As a result, the World Health Organization developed guidelines for children under the age of 5. These guidelines set in stone the amount of time that is recommended for children to be spending in physical activity, sedentary behaviour, including screen time and sleep. However, the evidence upon which these guidelines were based, which largely looks at associations between these behaviours and health outcomes, comes from high-income countries. Yet less than 10% of children around the world this age live in such countries. So this creates this mismatch. In addition to that, there is an absence of surveillance systems to be able to monitor how active children are, how much time they spend sleeping, and whether they meet the recommended levels of screen-based sedentary behaviours. So we know very little about these behaviours from a global perspective. This was identified in this report from WHO. However, they did say that the Sunrise study was addressing this in children under the age of 5. And that is what we are seeking funding for here. We have started this international collaboration with its headquarters here at the University of Wollongong. The funding is largely for the Collaborating and Coordinating Centre that supports countries as they collect data to be able to address these concerns from a global perspective. For many of these countries, this is the first time such data has been collected in their environments. And it is not only addressing the evidence gap, but it's building capacity among researchers, students, and other policymakers in those countries. Our coordinating centre supports countries as they go through the data collection process. And you can see here that we've already been able to involve more than 40 low and middle income countries from around the world. And we've been able to support a large number of countries to be able to collect data through both the pilot phase to show that what we are doing is feasible in their country, and then to a more larger scale where the sample is truly nationally representative, allowing us then to have data that these countries can use to advocate for the needs of their children. So we are seeking funding to continue this study, to be able to engage more low and middle income countries, to be able to allow not only the collection of this data to report on how much time children spend in these behaviours, but importantly, how the environments and the policies within those countries shape those behaviours among children. And with this evidence, that can be used to better advocate for the needs of children within each of these countries. You can see here that we've been able to engage not just a large number of countries, but also researchers in those countries and give them the skills to be able to build a career and to be part of an international network of researchers interested in these behaviours. These countries are supported as they seek funding to be able to conduct the study and then to be able to write those results up so that that evidence can be used to further benefit the children in their country. So we seek to be able to move forward with a protocol that will help address some of these inequities in child health from a global perspective, to give policymakers the evidence that they need to make informed decisions and to build strong international communities around these behaviours that can work together to address these challenges. Thank you.